And now, moving on, Menstrual Hygiene Day takes place every year, May 28th, and has grown into a massive global movement over the past 10 years. It is much more than simply the use of sanitary napkins and access to clean toilets, but a fundamental right for every woman, an essential aspect of their dignity, which signify impact the overall well-being of all menstruating women globally. Menstrual Hygiene Day aims to build a world where everyone has access to necessities, comprehensive period education, menstrual health service, and infrastructure that support menstrual hygiene and practices. Together is a crucial because no one individual can address the challenges that women face related to their menstruation. However, when we unite, we can make a difference. Interesting. I'm a man. I don't know what it feels like, but I know I have sisters, I have mother, and I know what it takes, that period of the month. And I have colleagues who are women. To discuss further on this issue affecting women and girls is the founder, Girl Child 365, Blessing Ajabiowe. Did I correct?
Very correct.
Very correct.
Very, very correct.
Thank you.
Thank you for having me.
Yeah, so let's talk about menstrual hygiene as a whole, in simple terms, and what these mean, that period of the month when it comes for women. And now, don't let me go to the mood change first, but let's even start with menstrual hygiene as a whole.
Oh, thank you so much for having me one more time.
Yeah.
And menstrual hygiene becomes a public health issue because a girl or a woman doesn't have the right knowledge, doesn't have the right education, how to manage herself when she is on her period. We call it period, we also call it menstruation, during the days when the blood flows.
Yeah.
And this is largely tied to the fact that we have been taught in the past as women to hide these things. Don't speak up, don't allow the public, don't allow anyone to see you menstruating, and then hide it, keep hiding it. It's not a public thing. We have to hide it. So this movement started in 2014 by the NGO Wash United, where everyone has been called to lend their voices to amplify their voices towards this cause, to ensure that everyone takes menstrual hygiene as a priority. Right. You have a girl at home, you have a woman, you have colleagues around you, like you rightly said before, so that we're able to speak up concerning these things that affect every woman. It's not a thing of shame. It's a thing of pride, because life comes out of this process.
Yeah. Interesting. This year's theme focuses on working together to address the challenges many women face.
That's right.
Which related to their periods.
That's right.
How can we do this? I'm still coming back to the mood swings pattern, but let's deal with all of this.
Okay.
How do we deal with that?
The campaign is for Together for a Period-Friendly World. It means all hands on deck. Right. The government, corporate organizations, CSR, NGOs, coming together to put resources together, lend their voices together, and take this campaign to the utmost part of the earth. We agree that in urban areas, the education is more there, but what's happening in the rural area is alarming. I like to focus on rural areas in my outreaches. Okay. I go to rural areas. You have to reach communities, and then the government is expected to have policies that support menstrual hygiene management. And thankfully, the one coordinated in Nigeria is by the Federal Ministry of Women Affairs. We had, on 28th of May, we had a big program right at the ministry where the minister, the Honorable Minister, Iman Suleiman Ibrahim, was present. She spoke her mind, and she's very passionate about menstrual health and hygiene management in Nigeria. So there's an ongoing policy draft to address some of these challenges and to make it official that the government is behind the women and girls in this country, to bring about wash facilities in schools, to bring about pad banks in schools, to make it more comfortable for the girl child not to miss her education. Because we have girls not going to school when they are menstruating, because they do not have the right knowledge on how to. Yes, like 4 or 5 days, a girl will miss school. Statistics has it to show.
Interesting. Very interesting.
So the government is involved, and thankfully, other countries we've seen a lot of improvement.
Another place that you touched that kind of got to me was when you said that you do your outreach at the rural areas.
Sure.
And you found out that at this stage, most of the girls at the rural areas, you find some of them using toilet rolls. You find some even using rags, unhealthy rags
that leads to infection.
Exactly, and it's good to have the policy draft, but to get it down to the grassroots is the main thing. And how do we get that? What is the role of the NGOs? How do we know that NGOs who are credible will be able to do the work for, to get those things down to those, so that they don't cite, forgive me, I've been in this business for a while.
I agree.
NGOs, some NGOs know how to corner.
I agree.
Okay, so.
I agree with you. And this question is very interesting because I remember saying that the Federal Ministry of Women Affairs is the one coordinating this activities in Nigeria, together with the Ministry of Health, Ministry of Water Resources, Ministry of Environment, because we're still trying to save the planet as well. So this is what we call technical working group, where NGOs and other stakeholders come together, still being coordinated by the Federal Ministry of Women Affairs to coordinate the activities of each NGOs, and we report directly to the ministry. There's a desk for it. So NGOs coming together as an umbrella is still being coordinated by the government to ensure that everyone involved is doing the right thing, and we're able to get to the grassroots with the right knowledge and the right interventions that will benefit the people at the grassroots.
Let's talk about cultural norms.
I love it, yeah.
And because this is a major challenge.
That's
really
right.
a major challenge. There are cultural taboos which lacks comprehensive, how do I put it, sexual and reproductive health education. Many girls don't, understand menstruation before it begins.
I'm one girl who never knew anything about menstruation before I started. And I always tell my story everywhere I go in the rural communities. My story is to encourage the girl child to speak up. Because this movement also is for, like we started by saying that is to amplify our voices, and to also break the silence and also intervene in some harmful taboos and cultural practices that are harmful to the girl child. I started at 14, not knowing anything. It came with a lot of pain. Some girls experience pain, some don't. And what happens? My mom didn't know. I didn't. Perhaps she knew. Of course, she's menstruating, but she didn't tell me anything. Let me use the right word. I wasn't told anything. The next day, the flow came, and I was given tissue paper to use. Of course, the drama every month. Long story short, after 2-3 months, no drama. I was called after some months. That thing that used to come, did it stop coming? I said, oh, I'm so happy because I'm not having pains again. I can freely move around. And my mom said, you are pregnant. Meanwhile, I had to do research after I became an adult because of the trauma I went through as a 14-year-old girl. I was withdrawn at some point because of activities and matters that now played out after that moment. I was taken to the hospital. You are pregnant is not, our African mothers now, it's not as simple as I'm saying it. With insult, with beating, with how you're going to disgrace us. We are 4 girls. I happen to be the first girl. No boy child. And an African mother is feeling unsafe that, I don't have a boy child. And my girl child, the first one, I'm afraid she might be just pregnant to disgrace me in my husband's house. Just maybe that was her thought. We're taken to the hospital. The doctor wasn't on set. The lab scientist told her, oh, yes, I'm pregnant, but she needs to go out. He wants to further examine me. And he wanted to assault me, told me to lie down on the table. Brought his fingers and he was about assaulting me. In my head of head, I was telling myself this is wrong, and I was afraid as well. I tried to close up my legs. And he called her in. Yes, he called her in to say I didn't allow for further examination. And then the insult continued. We went home. Long story short, another time we came back, the doctor was around. My destiny was about to be discussed. I was asked to leave the consulting room. Whatever was said, in my head of head, I know that the doctor must have told her, let me have a second opinion. That I know now as a grown-up woman. That there has to be a second opinion. Is she really pregnant? Is she not pregnant? Perhaps she must have told him that she does not have money. That is where poverty comes into play. She does not have money for another test. Whatever it was discussed, long story short, when we came back, I was sedated for whatsoever reason. That I knew later on as an adult that there was an attempted evacuation without my knowledge, without my consent.
But you were not pregnant.
I wasn't. It was a period of menarche when the girl child, my body is just registering to the puberty stage I'm entering. So it's possible for the girl child not to be ovulating every month as at that time. This can last till 6 months, even 1 year. But after 1 year, if a girl is experiencing that, she needs to go see her doctor. So I was still in that period of my body trying to adjust when this happened. I was traumatized at home. My father never said anything about this. He felt it was a woman's affairs, so my mom should handle it. So I was now imagining as my father read my story first time on social media. He called me to apologize. I was no longer at home. It was after service. I was already into this movement because I wanted to. That was where I birthed my purpose of passion, to be a voice to the girl child. I used to say it and cry, but now I can say it and just laugh because someone is learning. I've spoken in lots of places where women, mothers meet me and like, thank you for sharing your story. It has helped us know how to handle it better when our girl child experiences it. I was withdrawn. I wouldn't speak to my mom over anything because I just felt if she can't believe me over this simple thing, what else can she believe me? So I grew up with that gap between us. I was a quiet and withdrawn, timid child for a long time. I don't know where I found my voice. Perhaps purpose was calling me.
Oh no!
Purpose was calling me.
When purpose finds you, you find your voice.
So education is very important from the house. Before a girl child knows or gets into that stage of her life, it is important that the woman, the mother, the father, and every father, mother figure in the house, guide call your child, educate her. We're also fighting for this to be in the school curriculum as well.
Interesting. Thank you so much. While you were talking, I remember I was with a friend yesterday and we're talking and, just like the same case that you mentioned, but in our own case, our mother stood and said, no, my child is not pregnant.
Good.
Our mother stood and said, no, my child is not pregnant. So this is the case of parents listen to the voice of your children. It's very important, when you listen to them. When they are telling you in formal ways and informal ways, try and listen to them. It's very, very compulsory. The girl child, the boy child, growing up, when they grow up, the trauma that they face, you can't quantify it. You will want your children. So, interesting. Thank you so much. I really appreciate it.
Thank you.
I really appreciate it. Your story was touching.
Sure. Thank you so much.
Thank you. All right. That's what we can take on this episode of The Girl Chat. But interestingly, we'll